Today, we are talking about ovarian rejuvenation with PRP. And I'm not sure if you heard about it. This is somewhat of a new topic, but lots of people have been asking us about ovarian rejuvenation. So today, we're going to talk with Dr. Karacan from IVF Turkey to learn more about it. So if you are interested in ovarian rejuvenation, please do stick around. So I'm going to invite Dr. Karacan to join us. She can be our friend today. This is, as I've been saying, is a topic that more and more people are asking us about. Hi, Dr. Karacan, how are you?
Hello, how are you doing today?
I'm okay. How are you?
Fine, thank you very much. So now we can start answering our patients' questions regarding ovarian rejuvenation.
Exactly. And, I've noticed that this is such a topic that more and more people are asking about ovarian rejuvenation.
Right.
Because people are really curious about what it can do for them, potentially being able to have children with their own eggs. So maybe can you tell us a bit about first what is ovarian rejuvenation?
Sure. There's we know that the number of follicles, number of eggs located in the ovaries at birth gradually decrease by age. Mm-hmm. So a girl is born with almost 2 million eggs at birth, and it goes down to 400,000 at the age of 13, 14. And approximately again 1,000 eggs vanish or just die at each month. So it's obvious that all these numbers, all these eggs located in both ovaries decrease by age and completely finish at the age of 45, 46. Now the question is, because of the lifestyle changes on Earth, women have a tendency to conceive at a later age. Rather than at the age of 22, 23, they opt to get a baby at the age of 35, 36. So almost 10% of women worldwide suffer from low ovarian reserve or no ovarian reserve at all about age 35. So the question is it possible to activate, to boost this ovarian reserve and resulting in new follicle development if there is possibility? So because of this question, there are many studies to boost or to activate new follicular growth in the ovary. That's the idea behind all of these studies. Is it possible to produce new eggs or to activate more eggs for women to get willing to get pregnant? Hence, there are some medications or methods or chemicals developed to activate this system. One of them is PRP. It's platelet-rich plasma that is produced in women's blood, and we purify growth factors and platelets and growth factors inside the platelets. After purification of these chemicals, we inject this material into the ovaries in hope of activating or boosting ovarian reserve. So far, up to now, there are a few studies showing the efficacy of PRP. Unfortunately, we don't have too many options to activate or stimulate ovaries, to stimulate the growth of new follicles. So PRP is one of them, and we also apply these chemicals or this treatment to patients who have a low ovarian reserve and willing to get pregnant through IVF or through on their own. So that's the reason PRP has been developed to affect ovarian activity. However, it's not the efficacy of this method has not been proven worldwide, and now we don't know what type of patient, what subgroup of patients are mainly get benefit of this method. So there are many questions regarding the efficacy of this treatment. However, since we don't have too many options to boost ovaries, to boost ovarian activity, PRP can be used. We know that that's harmless, easily produced, and it's not a fine material injected into ovaries. And so far, approximately 10 to 15% of our patients benefited from the administration of these chemicals or these growth factors into the ovaries.
You know, I remember that even though it's relatively new in the world of fertility, these growth factors have been used in other areas of medicine.
Right. Particularly in plastic surgery. Plastic surgeons use this method very commonly. They inject PRP solutions into face, just under the skin, to boost collagen development or rejuvenation of the skin. Yes, you are right. We just learned from them.
Exactly. I've also remember many years ago when I was working in operations, orthopedic surgeons who were operating on knees of athletes. So we were collecting the blood and then centrifuging it and then injecting it into the joint. Is that how it works in the ovaries as well? What's the process like?
Yes, that's the same way we hope them to work. Yes, you're right. Orthopedics also use these injections into the knees in hope of better healing of the injured joints. Yes, you're right. So, but now in GYN, in reproductive endocrinology, that's the same idea, just to activate some stem cells, some dormant follicles, to get high number of eggs in women with low ovarian reserve. But what type of women are the best candidates to this treatment is still unknown, not well defined.
Yeah, and we have here a question. What is the optimal age for PRP?
In fact, we do not offer PRP over the age of like 46, 47. To us, to our clinic, the optimal age is between 38 to and 45, 46, not over 46, 47.
And so who would be eligible? Is it women who have, for example, premature ovarian insufficiency or have a low AMH? How would we identify patients who could potentially try it?
Again, the criteria of the best candidates benefiting from this treatment is still debatable, not well defined, well identified. But according to our patients, our study at the hospital, we carried out this injection in women with high FSH, low AMH, so poor ovarian reserve, but still having some follicles in the ovaries. We do not like offering this treatment in women with no follicle at all or FSH level being more than 25. We think this treatment doesn't work in women in a postmenopausal era, postmenopausal period. It doesn't work. Just perimenopausal transitional period may be a good candidate, maybe a well-designed group of patients who benefit from this treatment.
And I imagine, so how does the process work? Do they have the treatment in Turkey and then they have to repeat some tests to check their ovarian reserve if it has been successful?
So we first get their AMH level tested. just before the procedure, and after we draw blood, and 1.5 cc of PRP solution is injected into both ovaries, one into each ovary, 1.5, and 2 months later we repeat AMH level to test if there is any rise in between two levels. So we need to wait for at least 2 months approximately to get the efficacy of this application. So before the procedure and 2 months after the procedure, we check AMH level to see if there is any effect of this administration.
And is it expected that the FSH will reduce as well, or it won't have any impact on that?
Correct. So FSH is supposed to go down after the administration. However, AMH is a better marker than FSH in identifying ovarian reserve. So we do not test FSH levels anymore. It varies, but AMH is much better marker. That's the reason where we commonly have been using AMH rather than FSH.
And if women do a scan for an antral follicle count, would they maybe be able to see any follicles at that point as well, if the AMH has increased?
Yes, after the administration of PRP, it is possible to see the increased number of follicles, antral follicles in the ovaries. That's the aim of this administration. We observe this increase in, again, 10 to 15% of our patients. So AMH and scan, vaginal scan, are the gold methods, markers, so to speak, to monitor the efficacy of this method.
And I guess, how long does that benefit last? Do we know? Or
actually, we do not. But as soon as we observe a benefit of this method, we just advise our patients to go through IVF rather than waiting for some period of time. Just as soon as they get the impact, just should go and try IVF.
Yeah. And we have here a question as well about success rates of PRP.
So again, even though it's not been proven worldwide, we would say like 10 to 15% of eligible women who got this injection demonstrated some benefit of this administration. So 10 to 15% might produce better number of eggs. I'm not saying they're going to get pregnant, but ovarian response to medication might be a little bit better after administration.
And is it ever needed to do it maybe 2 times, or is it worth trying more than once?
So we tried maximum of twice in cases willing to get these injections. So, but no more than twice. Just twice is the maximum number. So we don't offer trying this method, trying this administration for more than twice.
And how can it impact on fertility treatments? Does that mean that you have more eggs to play with?
Yeah, that's the main goal, is to increase the number of eggs, hopefully. But of course, even if we obtain a high number of eggs in a woman at the age of 46, pregnancy rate is still low because of the aged oocyte, the aged core. I mean, the nucleus is still aged at the age of 46. So we may have some more follicles, some more eggs, but the pregnancy rate doesn't go sky high. So maybe this is the best time to get this injection is between 37, 38, and 42, 43, not older than that.
And I imagine that this is really almost like the last resort.
Right. Yeah, you are absolutely right. This is the last resort. So that's the reason we strongly advise women to get pregnant if they want to get pregnant before the age of 37, because after the age of 37, fertility potential, fertility rate drops significantly. So do not postpone your plans of getting babies.
And we have here a question about if a spontaneous pregnancy has happened after PRP, or is usually IVF always recommended?
It is still possible for women to get pregnant on their own. It is possible, spontaneous pregnancy is possible, but we usually mostly advise them to go through IVF as soon as they get the benefit of this administration, but it's still possible.
And I guess if we have a few eggs after PRP, would then those eggs also be suitable for potentially doing any genetic testing to check the quality before?
Sure, yeah. If they want to go get genetic testing before embryo transfer, it is possible to do genetic testing on the embryos, not on the egg, of course, but on the embryos. Yes, we can do that. It is possible.
Yeah, and I guess all of those strategies can really speed up the time.
You're right. That's what we hope. Another strategy is the use of stem cells. Again, the administration of stem cells or purification of stem cells, obtaining of stem cells in the bone marrow, in bone marrow, and then injecting these cells into the ovaries. That's with the same, in line with the PRP administration, hoping that these stem cells can turn into eggs in the ovaries and produce more eggs in the ovaries. That's the idea behind using stem cells in women. But there are still only a few studies in the literature showing the efficacy of the use of stem cells. So we still need further research, further studies to start using this method commonly. But sooner or later, in the next decades, not years maybe, but decades, they will be using stem cells as they are used in some other area, like cardiology, like liver. The stem cells might be an option to boost ovarian activity. This is the second method or strategy in hope of getting better eggs.
And would those two be used at the same time? So the stem cells with the PRP as well in the same procedure?
They can be used, but we don't have any studies right now which used these two alternatives, these two methods at the same time. So as a scientist, I can't say yes, they are used, but we are waiting for new studies to adjust or plan our best medical approach.
And I guess for the bone marrow, it's usually collected from the bone.
Right, it's collected
from the bone. So it's a bit more invasive than a venous sample.
Excuse me?
It's a bit more invasive than the venous sample for the PRP.
Absolutely. The second place or second area is to get stem cell is the adipose tissue. Okay. So we can get stem cells from the adipose tissue of women located in the belly area. It is also possible, but still there are many questions how to retrieve them, how to purify them, but sooner or later we'll be more knowledgeable on using stem cells in the treatment of poor ovarian reserve.
And I know that IVF Turkey, you're really specialized in trying to investigate these aspects. Do you feel that because in many countries they have access to egg donation, these techniques are not as advanced as they are in Turkey?
Right. Egg donation is not allowed in Turkey. Therefore, we focus on improving ovarian reserve in women at the not the advanced stage. All women are young. I'm not saying all women, but advanced stage. So that's the reason administration of PRP and stem cells are, hot topics in the practice of IVF in Turkey. So, but we still a long way to go to establish the entire treatment or the protocols about these treatments.
And Dr. Karacan, just a final question.
Sure.
For patients who are thinking they really want to try that, what would be their next steps? Is it a video consultation available where they can ask the clinical team about it, for example?
The first attempt would be sending their entire data, infertility history, the age, FSH, AMH level. So please contact one of our colleagues working either in the UK or in Turkey. Let's look at their data first, then talk about the options and the pregnancy rate through all these alternatives. So please send us your data, and then we'll decide on whether this method is beneficial to you.
Perfect. Thank you so much, Dr. Karacan.
You're welcome.
This was really, really useful.
Thank you very much.
We'll keep the
It's a pleasure to be with you, and Happy New Year, Merry Christmas.
Merry Christmas, and we'll speak again in January.
Okay, bye-bye.
Bye.